My name is Era, and I'm the host of the Tamil Creator Podcast. I chat with creators from all over the world to share their stories and discuss hot topics in a way that I hope inspires, educates, and entertains you. Hello, everyone, and welcome to another episode of the Tamil Creator. I'm your host, Era. Today, I have Aurthi Muthukumaran, and she is an emergency medicine and orthopedic surgery physician assistant, and also a very high-level tennis player. The second part's more interesting to me just because I got into tennis recently, but joking aside, Aurthi, thank you for jumping on the podcast.
Thanks, Sarah. Thanks for the opportunity to share my story.
Awesome. Well, I like to kind of start at the beginning. I feel like childhood definitely defines, or like at least decisions made by you or for you by like your parents or whoever it is, kind of really helps um I guess define a lot of the story of kind of where you are today. So in your
Mhm.
childhood, or like your formative teenage years, what were some things or decisions that were made that kind of resulted in you becoming passionate about healthcare and pursuing a career in that field?
Yeah, for sure. I think the initial kind of experiences that shaped to where I am right now, it did start with tennis. So something that you said you were interested in. My dad actually put me in tennis. I was a very active child. I was running around the house breaking things. So my parents were like, "Where can we channel this energy?" So my dad actually put me in tennis eight, which is actually relatively later to start in terms of getting into competitive tennis. But I started off in a summer camp, and then I actually pursued tennis at a competitive level up until 13. I was competing provincially, nationally, and eventually working up to playing ITF, so that's international tournaments. And then I actually sustained a shoulder injury. So at that point, when I was 13, I had to kind of decide what to do. In any competitive sport and in tennis as well, there is a critical window. So if you want to go pro, there's this critical window where you have to be playing a lot of matches and performing well to kind of go pro. And that was when I sustained my injury. So my parents did play a big role in that. My dad was very much into the tennis route. He always wanted me to go pro. He wanted me to become world number one, which is always what he said. Every time I was on court, my mom was a bit more, obviously the motherly side of things was, you're getting injured, is this something that is sustainable long term, and always kind of have academics going for you. So as I transitioned from middle school into high school, I actually started shifting my focus into academics. I was resting my shoulder and started focusing in school, which was the difficult transition. But it was actually tennis that actually sparked an interest in more the human body, how injuries happen. And from that, I was like more drawn towards sciences. So took a lot of science courses, and then I even did like a health and wellness specialist high skills major program in high school, which allowed me to kind of dive into more the health realm as early as high school. And then in grade 12, I took a kinesiology course, which was a good mix of science and sports. And that actually helped me determine my undergrad. So I would say it was a mix of like going through that sports, like going into sports and that experience and sustaining an injury, which kind of made me curious about the human body and eventually led me to healthcare.
That's so interesting that your dad was so supportive of, or like wanting you to kind of be a professional tennis player. It's like very unusual. I mean, maybe I'm not exposed to enough stories, but I feel like because I
No,
have another friend.
definitely very atypical. And that's what my relatives and every, like, when I was growing up, it was like, oh, it's very unique, especially for like a female to be like, put into sports and pursue at like a high level in our culture. So my dad was definitely unique in that, and I'm grateful for that too.
Yeah, I have a friend Ben, as well. He played high level tennis. He's brown as well, and I think at some point I forgot the. I hope I don't get the stats wrong. He was like the 30th ranked player of his age when he was like 16 or 17. And
Hmm.
then his parents didn't want him to do tennis. Like I think he wanted to kind of pursue going to the States or
Hmm.
something for a scholarship, but then they wanted him to do med school. So they're like, yeah, you're gonna have more options by doing this. So it's like I mean, it's great that your dad was like that. I'm a parent now too, so like for me, I think I would try to fall under kind of what your dad is, which is like whatever my kids are into, try to like support them in that. But it's just like really refreshing, obviously, to hear. But it's really cool that your dad was like that or is like that. Sorry.
For sure. For sure. Yeah. No, I definitely think it does shape how you pursue opportunities and how you kind of lead your life, especially when you're exposed to that kind of mindset when you're young. So I'm grateful that my dad was like that.
And I think I read like tennis kind of leading down the path of becoming a physician assistant because you're already kind of thinking about it, but I think I read that you played somebody at a high in like a match and
Yeah.
he or she was also like a physician assistant as well. And
Yeah.
then after that, you kind of really delve into this career path.
Yeah, exactly. And so this was, I believe, second or third year of undergrad. So I played all 4 years at Western University. I played varsity tennis, and I think it was second or third year. I played a match against one of the McMaster tennis players, and she actually did undergrad at in the States, which is a typical route for those who play tennis in their teenage years, and great way to get scholarship and go to the States and have that experience. Um, but she was back to Canada to do PA school at McMaster University. So that whole tennis match was just like a networking opportunity for me to meet her. And we actually played when we were younger. So we met each other when we were 11 or 12 and then reconnected when we were in our 20s. So it was nice to kind of catch up and then learn about a new profession. And then that kind of started my search into the profession. I think I learned about it and then I forgot about it in third year and then revisited in fourth year when I did a Google search. But tennis definitely led me to PA career as well.
Yeah, for me, like I think I mentioned to you, I've never heard of this until more recently. I think when you were kind of brought to my radar as well. So I guess number one, how old is this kind of role? Like, is this relatively new? Has this kind of always been there and now it's just kind of emerging in popularity? And like, why are you such a vocal advocate for this particular career path for the younger generation?
Yeah, that's a great question and a typical question we get working as a PA in Canada. So often people ask us, what is a physician assistant? I've never come across one, and it is relatively new in Canada. I would say um, probably anywhere like I think we just got to 12 or 13 years in terms of the civilian programs. It has been established in the military field for quite some time historically, and then it got transitioned into the military or in the civilian world. In the States is actually way more established. So you'll see PAs are quite autonomous and they're in different settings and well established there. So Canada kind of looks up to them in terms of establishing the role, even though the healthcare system is different. In terms of my advocacy for the role, so I actually, when I considered the pursuing becoming a physician assistant, I actually initially wanted to go to the States. And then I was considering options and then I chose to stay closer to home. One of the reasons being joining like a smaller group of trailblazers for the profession and just seeing the impact that PAs have in our Canadian healthcare system. So just some of the general kind of trends we see is adding a PA to the emergency department, you reduce wait times because the PA is there to kind of see those quicker fast track cases. In family medicine, you're able to see your family doc or PA earlier and get an appointment earlier, but also the quality of care goes up because you're spending more time with patients per visit. So there's more time for patient education and making personalized health plans. And then from a surgical perspective, working in orthopedic surgery, there's earlier discharges because there's a PA on the ward facilitating like care every day and then, taking care of the rehab applications and promoting that early discharge, but also in the operating room. So assisting in the operating room. So more throughput in terms of the number of joint replacements done. So that's something that is actually a focus at SHN, so Scarborough Health Network. So many effects or so many benefits of adding PAs to practice in different specialties. And I think personally, you mentioned this earlier, a lot of Tamil parents want their kids to become doctors. And I think that being vocal about this, especially on this platform, is to say that you can pursue a career in medicine. And the pro of or the benefits of pursuing the PA career path is that it's shorter schooling, less in terms of financial burden, and you also have the option to switch specialties. So you don't have to choose one specialty. Like myself, I've worked in emerge orthopedic surgery and actually just recently started in family medicine as well. So there's that opportunity for continued growth. And if you're someone who likes variety, which is something that really resonates with me, then the PA career option in terms of pursuing a career in medicine is an option for Tamils as well.
Yeah, so I guess with like a physician assistant, I guess I'm trying to think of another analogy in like another healthcare role. So would you say it's similar or close to like what a physiotherapist assistant would be to a physiotherapist, or is it like what are the different things that you would be able to do, or like I guess a physician would be able to do that you wouldn't be able to do, and vice versa?
Mhm.
Just to understand that for myself as well.
For sure, yeah. So a few points on that. So PAs are often compared to nurse practitioners. So in terms of scope, there are some differences in that PAs are trained using the medical model, and nurse practitioners trained using the nursing model. And NPs are actually often trained for a specific specialty. And as I mentioned earlier, PAs have that flexibility. So it's called a lateral mobility to switch specialties. The caveat being there's a steep learning curve every time you switch specialties. In terms of physio reference, I like to say, so prior to pursuing PA career path, I was a kinesiologist. So I would say akin to a physio, a physiotherapist, or kinesiologist or a physiotherapist would be somewhat synonymous to a physician assistant to a supervising physician. I could say my brief blurb that I usually say in terms of what people ask when people ask, what is a physician assistant? So PAs are basically healthcare providers who work collaboratively with supervising physicians. So in a family practice, it could be a couple, but in an emergency department, I worked with maybe 50 to 60 physicians and different ones every shift. And your scope of practice mirrors that of your physician that you work with. So in Emerge, I would see patients in terms of starting the visit. So I would go take the history, do the appropriate physical exams, order the investigations, even order treatment options for them. And then sometimes you would also do procedures, which is actually a pretty big role for PAs in the emergency department. So this includes suturing lacerations, putting a cast or splint on broken bone, also doing like incision and drainage for an abscess. So different hands-on procedures like that, and also like facilitating discharge. So making sure that if a physician already started the visit, then you can kind of facilitate discharge. So they played a big role in like the flow in the operating room. So in orthopedic surgery, I did assist in the operating room. So that's something you can do if that's something you're interested in. And in family practice currently, I basically split like the patient load with the family physician. I discuss cases with them, and then I'm pretty quite autonomous in that setting as well. So in general, they work alongside physicians under their supervision, and eventually with time you become autonomous and you see patients, and your scope of practice is quite similar to that of the physician or the surgeon you work with.
That's amazing. So it sounds like, I guess, I mean, there's a lot of challenges in their current healthcare system, but bringing on more PAs would definitely help alleviate some of the wait times, and just to see somebody in emergency, or like even like family doctors and things like that. It sounds like, does that sound about right? And if so, like, are there initiatives or programs being kind of pushed by the government to kind of get more education around the career path of a physician assistant?
Yes, another great question. And I think that the pandemic actually really helped us in terms of highlighting the PA role. So during the pandemic, PAs were highlighted in helping alleviate the stress, the wait times in the emergency department. In terms of surgical output, we mentioned that they improved the discharges so you could continue doing the joint replacement surgeries as we kind of came out of the pandemic. And actually, post pandemic, now we're seeing, if we could say we're post pandemic, but post pandemic, we're seeing that a lot of PA programs are being opened up across Canada. So Nova Scotia actually recently just started a program, and they started in January, so this month. And then Calgary's considering, Ottawa's considering, and they're also I think in BC, they recently opened it up to PAs helping out in the emergency department just to alleviate some of the stressors that they're facing. So I think in different specialties, they're seeing the benefits, and there's different pilot projects that they put in to kind of start it up. And across Canada, you're seeing more PA job opportunities pop up and more programs opening up. So it's definitely going to be something booming in the future.
This episode is sponsored by nobody. That's right, nobody. So if you could be kind enough to hit that subscribe button, that would mean a lot to me. So in Ontario, or at least kind of the GTA area, or I guess Ontario, Southern Ontario, was Western the first university to kind of introduce this program, or are there other programs in other universities as well?
So I did my undergrad in Western. So I did at Western. So I did kinesiology and medical sciences, but I did my PA training at University of Toronto. So there are two programs in Ontario at University of Toronto and McMaster. And then Ottawa is something that's on the horizon. And in terms of the first program in all of Canada, I believe in terms of civilian program, it was University of Manitoba.
So how many PAs are there Because I think you had like tweeted about or like wrote about like there's like National PA Day
Mhm.
recently or something like that. So like how many people are a physician assistant across Canada today? If you know the answer, I don't know if you do, but
I think we're still under 1,000. So when I started training, it was around 600 something. I think we're up to about 800 to 900 something now, but we're still under 1,000. But again, with more programs opening up and even the existing programs expanding the seats. So at the university program, which I'm involved with, we actually just increased the class size from about 30 students to close to 50 students, with the potential to expand again. So we're definitely going to push out more graduates and more PAs. So again, that number could go over 1,000 probably next year.
and I know you said you kind of decided to kind of stay closer to home to kind
Mhm.
of, work with a smaller team of like trailblazing folks in this particular career path. Why specifically SHN versus I don't know if there are roles in kind of like UHN and like other networks, but like why specifically SHN?
Yeah, that's something that I had to reflect on as I finished PA school and I was kind of considering job opportunities in terms of specialties, but also environment. And I think SHN resonated with me because of the Tamil community. I think that emergency medicine was great in terms of challenging me, but specifically SHN was great because I got the opportunity to give back to the Tamil community. You could connect with the patients, address some of the barriers that our community members face, including language barriers. Some of the stories still stick to me, but just as simple as talking to them in their language will go a long way in terms of making them feel comfortable and getting the care they need in a timely manner. So I think those were some of the motivating factors to pursue a job at SHN, and it was definitely rewarding, or has been definitely rewarding, working at SHN for that reason.
And for somebody kind of listening that's younger or just considering, they might consider this career path after kind of listening to this conversation as well. Maybe paint a picture of like what your typical day looks like. If you have a typical day, maybe it's different each day, but
I guess I would have to cover three specialties because no two specialties are the same in terms of typical day. I started off in Emerge, so I'll start with that. The shifts were typically 10 hours, anywhere from 8 a.m. start time to 6 p.m. start time. So there were night shifts. Your shift could start off with you starting off just seeing a patient on the tracker. So you'd go in, get the history, do the physical, start the order the investigations, or you could walk in and a doc is asking you to help with a laceration. So, hey, can you suture this patient up for me and discharge them? And with Emerge, it's basically no 2 days are the same. It's anything that walks in through the door. So you kind of just have to be quick on your toes and act accordingly in terms of what's needed in terms of patient care, but also what's needed in terms of maintaining flow in the department. I will say that it is quite an intense specialty in terms of the medicine because you're a generalist. You can, it's not only one niche specialty, but it's also challenging that every patient has a different kind of presentation and you have to be very hyper focused on the detailed, but also very efficient in the care that you provide while also being your bedside manner has to be great in terms of being comforting for the patient and making sure that you're compassionate. So lots of skills that I picked up in my first year. And then I guess going to my second year of practice was opportunity came up to trial ortho surgery while my one of my classmates went on mat leave. So another steep learning curve. I was always interested in ortho. I did my elective rotation in that in PA school, and I also, with my background in kinesiology and sports, it was something that was just natural in terms of being interested in it. But this one was different in that I was responsible for managing all the orthopedic patients on the ward. So definitely slower pace, more comfortable, but a bit more of a mix of internal medicine and surgery. So this is where I got the opportunity to assist in the operating room, which is super cool. Ortho is very physically like intensive. That it's a lot of like bone. You're like hammering bones, you're cutting bones, you're sawing bones, and there's a lot of joint replacements at SHN. So being able to be part of that, and some of the surgeons with many years of experience. I think the oldest surgeon was like 83 or something. So it was just like a good learning experience. But yeah, no 2 days again. Where actually, I would say for ortho, maybe you could say there's a typical day in that you'd start off, you'd go review the patient's files, the blood work, and what the plan is, and then you go round on the patient. So you go see how they're doing, adjust medications, order investigations as needed, and then also facilitate discharge planning and attend like family meetings as needed. So some days would vary, but overall that was the general flow. And then lastly, family medicine, are pretty consistent. So I work like 7 to 8 hour shifts, and you would just share the workload. So it's a mix of family practice and walk-in clinic. So the walk-in is similar to emerge and whatever walks them through the door, and you kind of see the patients. And again, general medicine, and then family medicine is more like chronic disease management. So like diabetes, high blood pressure, and things like that.
How did you know you could stomach things like cutting through bone and things like that? As you're saying that, I definitely know I'm not built for that, but how did you kind of, I guess you just kind of do it and you kind of realize if you can handle it or not, right?
Yeah, I guess I mean, I didn't know until I kind of put myself in this situation. I think in PA school when I did 1 day placement in general surgery, it was 7 a.m. and I was asked to retract a patient's abdomen, and I was like, I don't know if this is something that I'm comfortable doing. But I think with time you get used to it for sure, and emerge like you see everything and anything. So you eventually kind of build this like you build like what is it, resistance or resilience to it, so that doesn't bother you anymore. It's kind of just like dealing with whatever's needed in terms of medical care.
Yeah, I guess I mean I thought of it before, but now that I'm talking to you, just realizing the kind of things that people in medicine see and like to be desensitized to it. Like for me, like if I see, I don't know, like an image of like open skin, like I just like uh, I can't handle it. So I
Yeah.
applaud everyone in like healthcare who's able to do that kind of work. But yeah, I guess going back to how much of an advocate you are as well, I think it was recognized, I think, and I could be kind of speaking out of turn, but like you won an award, I think it was Excellence in Leadership, HPAE community affiliated within kind of SHN. Um, what was this award about? Like, why did you end up winning this award? Is it related to kind of the advocacy work you're doing around this particular topic, or what else was there?
Um, I, it's hard to know where exactly it came from. I believe my program director. So I also work as the academic coordinator for the U of T PA program. So the program director, Dr. Peter Zach, I believe, nominated me for the work I did. And U of T is affiliated with SHN as one of the community hospitals. So just the leadership role in terms of being like a graduate of the program in November, guess you don't need the exact month, but like 2020, and then actually starting off helping out with the program. And I basically brought in my experience as a student in the program to make curriculum changes and work with the program director on student advocacy and changing the curriculum to better train PAs. So I think that was the program director's way of recognizing that work, and coming up to 3 years in that role now.
Well, that's amazing. Something I want to kind of come back to as well, just thinking of the younger audience and as they're kind of, going through school. And I think the fact that you did high level tennis and kind of balance that with, a challenging academic program as well. I guess number one, how did you manage that? Because I had another guest on here. He was a very high level basketball player, but he was in like a, similar kind of program in terms of computer science. And, just managing kind of the demands of training and playing while also balancing a full academic caseload. How did you do that?
Yeah, it was definitely something I started doing from a young age. When I was playing competitive tennis younger, I most of my days consisted of being on the tennis court, so I had to fit in academics around that. So I would say I started off on the court at like 7 a.m. and I would finish up practice with breaks in between for school and just homework time. And I would finish at like 9:30 p.m. and then start again the next day. So, and then tournaments over the weekend. So it started when I was again like maybe 10 years old. And then as after I got injured, a lot of high school was just catching up into kind of shifting that focus to academics. But when I went to Western, all 4 years, I played varsity tennis, and weekends in the first couple of months of every school year were matches. And then weekdays, again, we had a couple hours of tennis and a couple hours of fitness at the gym. So I actually had to plan ahead. So I would like think like a few weeks in advance and figure out like when my matches were, when my practice were, and whenever I had time. And even if an assignment was due or if a test was like coming up in a couple of weeks, I would just start earlier so that I could actually be ready and it was not something I was cramming last minute. So I think in a way, it did teach me time management skills and also discipline in that, like, you don't have that luxury of saying, okay, I don't feel like studying today. Sometimes you only get that 2 hour slot on a specific day and you have to make the most of it. So I think to this day, I still use that kind of mindset. I always like plan out 1 month in advance and see what's coming up and then usually try to do things ahead so that you have that flexibility.
because you have these long days of like 7:30 a.m. to like 9:30 p.m., very long days. I guess it kind of prepares you in a way for, I know you said some of the shifts were kind of a bit more typical, like 8 a.m. to 4 p.m., but those 10-hour days probably felt normal because you were kind of used to that for, your pretty much your university career. Um, and I guess as well, this is more of a, I guess, a personal question, which is, I wouldn't say I'm similar to you, but I feel like I'm a, because I have a lot on my plate, you have to be good at time management. And I guess it's part of our nature to kind of achieve or do these things. But do you ever kind of look back and be like, oh, I did a lot of things, but I didn't kind of give myself room to, because like sometimes you're so busy doing, you don't really get to kind of sit in and kind of appreciate what you've kind of done because you're so conditioned to kind of achieve. Just curious, like if you ever felt that way or reflecting back now, if that's like something you're like, yeah, you know what, that was kind of the cost of what I had to do, or are you kind of like, hey, that's something I wish I did more of, and maybe I'll build that more into my life now.
Yeah, no, I think that's a great question because it is something that I'm reflecting on as like kind of you go through different chapters of your life. So I am curious to actually hear your thoughts on this after I share my kind of perspective. But I think when I was younger, my focus was always on school and tennis. So there was never really a question in terms of my priorities. It was always kind of focusing on that and giving it my all, my 110% effort. And looking back now, I think that I'm grateful that I did that because they gave me transferable skills that I kind of keep up to date as I transition into the work life. But now that as your life is kind of shifting and you're starting to see, like, after facing burnout and stuff in work, you start to see, okay, you're putting in all this effort into work, but what's the other things that you want to do that you've been kind of putting on hold? So for me, that's travel, spending time with family and friends, and just taking a day off to do things that I enjoy that's outside of work or school. And I think as that shift happens, you start to think, is it worth it, or is it something that I should do differently? So I don't think that I regret anything I've done thus far in terms of kind of prioritizing school and even like the time on court as I was like training to be training to go pro. But I think that as I move forward and different life experiences happen, starting a family or things like that, your focus shifts. So I think you said that you're a parent now. So I wonder how your I guess shift in that multitasking and time management kind of happened as started having kids and you're managing your time that way.
Yeah, no, I think did you know that every time you left a 5 out of 5 review for this podcast, a Tamil parent lets their child pursue a career in the creative arts? Okay, that's probably not true, but if there's a chance that it is, do you really want to jinx it? Leave a review. Do it for the young creative in you. I think, well, you probably experience it as you kind of take on different responsibilities, but having kids is just kind of another set of responsibilities. So I think there's a finite amount of time. So it's really, how do you balance doing something sustainably and like long term? So, obviously I just had to for me, I just had to cut down on certain things. So maybe less socializing or I guess it's going back to the drawing board of, hey, what are the three most important things I got to focus on? Fit those in, and then whatever I've left over, I either rest or, try to do other things as well. So, um, yeah, I think that's, and also it's just like, I think the more things you have on your plate, it's like paradoxical in the sense that you actually do those things faster because you don't waste time. I feel like before I had kids, I was like, I had way more, like now I'm looking back, I'm like, I had way more free time, but I feel like I didn't do much with it, which is probably a good thing. Maybe I was relaxing or whatever the case might be. But yeah, now that you asked that question, that's my reflection.
Yeah, no, it's interesting because I remember when I was in undergrad and tennis was still like a big part of my life. And one of my, I think it was my boss at like one like Oxford tutoring, and he's like, "It's great, keep it up, but like once life gets busy and you have kids, and I think he recently just had kids a few years back. He's like, you don't have time for these hobbies and stuff, so just enjoy it while you can." And I'm like, well, like if you want to, you might be able to maintain it. But then now I'm looking back, I'm like back to school now doing my master's, and I'm like, I haven't been to the tennis course as much as last year when I was just like working. So it's true. Like when there's like multiple things on your plate, you have to see what your top priorities are, and those priorities may shift as you kind of go through different phases of life. But when it comes to like family and stuff, I think and having kids, like that's when your shift kind of is a bit more like long term instead of like something like pursuing a hobby or something like that. So I think
How,
I'm kind of like reflecting on this moving forward, and it's interesting to hear your perspective too.
how old are you now?
I'm 28.
So I'm 10 years or just over 10 years older. It's crazy because I guess like this is me 10 years, like I guess you might feel the same way in like 10 years, but the way your body recovers and like the stuff you're able to handle when you're younger, regardless if you have kids or all that stuff, it's like just age-wise, I've definitely noticed like sleep is like more important. I think as you get older, I think you just realize like your mortality and like I try to like health is like a big kind of theme for me in the last couple of years of making sure like I play ultimate frisbee twice a week. I try to work out like regularly. It's not even like aesthetic, it's like more functional. Like I need to be healthy. I need to when I like engage or like play with my kids, health is like a big one for sure as I got older. And it's also like the realization that without health, or you can't, if you're not healthy, really nothing else. I mean, there's stuff that matters, but like everything else matters way less because especially if you have a serious health condition, like luckily I don't have anything for now,
Mhm.
but I do know people that were like their life circumstance, like their health circumstances change and changes everything. So that's like, yeah, again, just like a focus. That's like a
No, that's
tangent, but
very
yeah, yeah.
definitely very interesting because you're right. Like when you're younger, you play sports for fun and it's just something you enjoy doing. But as you get older, a healthy, it's almost like a lifestyle. It's not just working out or going and playing sports for fun. It's like something that you have to do to have like a good like physical health, but also mental health as well in terms of not overdoing it where you're burning out and not being very, I don't know, like a sedentary lifestyle, especially during the pandemic that has happened with people. And that has consequences, which you have to kind of work towards mitigating as you get older. So, yeah, definitely those are some tips that I'll keep in mind. And I'm actually working on like getting back into a proper workout routine and working from home or some of like, the flexibility that you have and being back to school. I have a bit more flexibility with my schedule. So I'm trying to take advantage of that. And again, it's a lifestyle habit instead of something that you just like pick up and drop. So, um, yeah, those are good tips.
Yeah, I think two things I wished I don't know because you're like like you play tennis at a high level, but I played like like basketball and other things like in leagues. And I was I think when you play sports, you generally are very competitive, but it's just a realization that, I mean, it was good to be competitive, but it was like, I don't know if you were this way as well, but like I was unnecessarily overtly competitive, which I think was a detriment to kind of, just not relationships, but like more so like how people perceived you. And I was the only one. There's like, everyone was kind of competitive, but like now that I'm older, I'm like, I'm still competitive, but like more so like I'm not worried about if our team wins because like that will negatively impact like how it could potentially interact with other people. It's more so, hey, I'm going to get cardio and like work on these specific athletic things that I want to work on while helping the team win. But if we don't win, no biggie versus like 5, 10 years ago, it's like I would be if I lost a game, I would sit and mope for like that night or something, which I was like now thinking about it, I'm like it's this perspective, right? Like there's like so many other things to like worry about now. So anyways, yeah.
That's also interesting because I that was my shift in mindset. So when I was younger, I don't know, like this is my kin background coming into play, but sports psychology says like there's extrinsic motivation, so you're doing things for like outside factors, and then there's intrinsic motivation, and it's exactly what you said. So when I was younger, I played tennis. My dad was very intense. He's this intense Tamil father who's like on the sidelines, like looking at me, saying I should play my best tennis and like the goal is set so like the bar set so high that like you can't afford to make mistakes, you have to win every match. And I started 4 years later than the rest of the people in my group. So it was a lot of external kind of factors. When I was young, I didn't know, like I enjoyed playing the sport, but I didn't know kind of what was at stake. And like when you're young, you don't really know, you just kind of do things to make your parents proud and do things that you enjoy. But once I got injured and I took that break and I went to play at Western is when I liked that team dynamic. So it was like, I'm not only playing for myself anymore, I'm not playing for my parents, I'm actually playing for our team. I'm playing for the university. And that kind of made me fall in love with tennis again in a different kind of lens. And it also made me enjoy the sport more. And it had this social component to it. And then from that came like, okay, now I faced that same shoulder injury, kind of came back when I was at Western. And then that shift to like, okay, let's train so that I'm actually healthy. Let's train so that this is actually something that is going to be long term, where I'm not like having these pauses in my game with injuries, but I just like adopt a healthy lifestyle. And growing up, I never liked fruits and veggies, but I was eating healthier at Western. I felt better on court. I didn't even need to take breaks. I lost like 15 pounds or something. I trained at the gym over the summer every single day. And it was just adopting a healthier lifestyle because I enjoyed what I did and I wanted to do it more consistently without injuries. And then now tennis has become more of a social sport where like even in the summer when I compete, I play for a club and it's like more of a social thing, something I look forward to when I'm done with work. And it just becomes more of something like a lifestyle. So again, I'm transferring that from the tennis court to the gym and that you're training, for good cardio, which will have health benefits, but also just strength training, not only for aesthetics, but also just being stronger and like, saving your bone from osteoporosis down the line. And like, as a healthcare provider, these are the things you start thinking about. So I think that mindset is definitely important. And that competitive aspect became a bit more like, instead of competing for my parents or like, just for myself, it was like a team based and then it became like a social thing. So I think I kind of relaxed a bit as well and enjoyed my time on the court, being a bit competitive still with the end result, but in a more relaxed manner.
Yeah, I guess relating to your like extrinsic motivation, I think it's this whole like I guess learning for me as well, related to that is how to structure things or like frame your mind so that the things that you do, whether or not you get the result,
Mhm.
you still kind of get there's a benefit. So an example is like people are like, oh, why do you do this podcast? Like I guess they're like looking for ways that I benefit. But the way I look at it is like I don't really control what is the outcome of me releasing an episode, like if what opportunities or people I get to meet, it's like, hey, if I'm doing this so that I get better at how to interview or like how to create content or whatever it is, as long as I'm doing that, I'm getting better. Cool, I've
Mhm.
already got the win. If other things happen as a result of it, that's great, but I don't control that. That's like kind of additional benefits, but it's already like I've already won because I'm doing the thing that I want to do and trying
Mhm.
to get the thing or like getting better at the thing that I want to get better at. So yeah, I feel like that's like even for like health or anything like that. Like for example, when most people do fitness, it's like, hey, I want to lose 15 pounds and get like ripped or whatever it is. But it's really hard to control all the factors that go into getting healthy. But if you're like, hey, every day I'm eating well, I'm sleeping well, or I'm doing it better like than I did a year ago, you're still winning. Like your habits have like you've developed habits that are winning.
Yeah, and that's exactly it. It's is it outcome in terms of win or loss, or is it growth? So are you a better person today than you were yesterday or last year? And that in itself is a win. So I think that's also a good mindset because it puts less pressure on the result and puts more pressure on things that you can focus on improving and becoming better every day. And I think that's like usually the mindset for like professional athletes. Like some of these professional athletes, they say, okay, I came back, today was better, but the next day will be better. And when they're playing a point, is like, is this point better than the point I played before? Or is this game better? And they focus on like those smaller steps in a way, and that the large, like the game, they win the whole match, or the long-term goals kind of just automatically happen. So focusing on personal growth instead of the results will eventually lead to like a long-term win in a way.
I guess for you, I mean, it kind of ties into kind of what we're talking about right now, but from a personal and professional point of view, where do you see yourself in like the next 35 years?
Yeah, that's again well, part of my reflection right now. As so, I'm currently back in school now. I'm doing my master's, and part of my reason for pursuing master's was it's a mix of actually public health and education, specifically focusing on healthcare providers. So part of it was because of my role as the academic coordinator. So how to continue improving the curriculum for future PAs, but also um, being a better like educator. So when I teach these PA students, how can I teach them better? How can I make them think as clinicians so that when they go into practice, they're able to kind of apply that and practice to their best abilities. But the other aspect of this is the public health aspect. So how can we address some of the barriers that Tamil patients face, especially in the Scarborough community? And seeing it from an orthopedic standpoint, like you see patients coming in for knee or hip replacement, or if they sustained a fracture from a fall, which happens, and then like the aftercare where they're not understanding why rehab is important, why they need to push through the pain. There's like cultural factors, but there's also that language barrier where they are not like the physio or someone is not able to communicate with them. So maybe like resources and things like that. So I think from a professional side, I definitely want to either dive into some of, like, one of the specialties that I'm already involved in, or potentially, like, especially like the orthopedic specialty, or potentially um, try out other specialties, which is, again, with the PA role, you have that flexibility. Um, that being said, my primary focus, I always told myself, like, my 20s is like, I can grind hard in terms of my professional life, but I do want to slow down as I kind of get into my like late 20s, early 30s, so that I spend more time, or allocate more time and energy towards my personal life. So, spending more time with family and loved ones, starting a family, and especially being female, that's something that you definitely want to allocate a lot of time. And then making sure that, one of my mentors always used to say, you learn to work smart, not hard. So you establish yourself, you grind hard in your 20s, and then you establish yourself in a way that you don't have to work hard, but you can still, do valuable work and quality work, but working smart. So whether that's working from home, or working flexible hours, and then that way I can dedicate more time to my personal life.
Love it. Money can be hard to come by, but here is a $100 opportunity for you. Join my free newsletter for free exclusive content and a free chance to win $100 when I hold special draws. Did I mention that it's free? In terms of, I guess, failure, or like I like to frame it as like a learning lesson, what's something that you've experienced from like a failure or learning lesson perspective in the last, couple of years, or and like I guess recently, and what did you learn from that experience?
I mean, recently, I was gonna say the tennis example. Like that trajectory of becoming a pro tennis player, just kind of crashing and then making that shift. But in terms of a recent example, I would say, like, I don't know if it's a failure, but definitely challenging. I did mention this briefly before in terms of the steep learning curve when you switch specialties. So I started off in Emerge, and it was a steep learning curve. And our chief always set the bar high in terms of how many patients you see, how quick and efficient you need to be. So that job, I felt like I had a lot of mentors and senior PA colleagues I could kind of lean on, and be able to meet that requirement or meet that standard that the chief set. But when I transitioned to ortho, I was like, okay, I have a background in kin, and this is like anatomy and MSK stuff, which I'm comfortable with. But the surgical side of things threw me off, and it was like super challenging. And I think when something's challenging like that, you have to kind of pause and see, like, is there something you can do? Like, is this something that's short term, or is this something that is like just like here to stay, and you can't really do much in terms of kind of moving past that challenge? So with ortho, I had this challenge, and I'm sure you've heard, like, surgeons are different in terms of the type of docs they are. So a bit more intimidating, but difficult to kind of communicate. And they're also, like, in the OR or like in clinic, and they're always very busy, so hard to ask for help. But I basically learned to like advocate for myself, and kind of push through that. And then now my role is actually, or like recently, I developed this like new referral process with the chief to basically improve the care from emerge to ortho transition. So that opportunity came up after kind of facing that challenge in ortho. But it's funny because like now it's happening again as I start in family med. I'm like, okay, this is a new specialty, and now it's challenging yet again. So I think that it's not necessarily a failure, but in terms of when you do feel like you are failing at something, and when something is challenging, kind of see how you can push past that, because it does, like, that's life, right? You're going to face obstacles, you're going to face challenges, and how you kind of navigate through that will help you face another challenge. So for me, it was ortho before, and then now it's family med, and I'm having that kind of riding that steep learning curve again. And now that I have an like experience doing that in another specialty, I feel a bit more confident. But every challenge is new, and every or every challenge comes with like new kind of nuances, and you have to kind of learn to navigate that. And so that's kind of something I'm doing now. But yeah, hopefully that's a good example.
And if you had a chance to go back in a time machine and talk to 16-year-old Aurthi,
Mhm.
what would you tell her?
16-year-old Aarti was definitely an overthinker and a perfectionist. And definitely, I think 12 years later, I've learned that not everything goes the way you want it to. So for me, like, I've kind of, it's not a linear path. So I would say just take advantage of any opportunities that come up, even if it seems like we were talking about the plate analogy, even if it seems like your plate's full when you're young, take advantage of every opportunity, in that you have something to learn from it. There's the opportunity to grow. And keep reflecting. I would say keep reflecting when you do, go through different milestones, and make sure you celebrate the wins. And then when there's a challenge, make sure you lean on your family and friends, because they also know you best and they can kind of help guide you through that. So enjoy the journey, and it's not going to be perfect, but that's totally fine.
And I guess looking forward in terms of like a personal legacy point of view, in a few sentences, like how would you want to be remembered by friends and family?
Yeah, this is an interesting question because I'm trying to think of myself as like, my whole life, or how my whole life would be. So far, it's very, very professionally focused in terms of like what I've done for my career and also like tennis wise. But I think that something that comes to mind is my friends always say, regardless of what I pursue, whether it's like tennis or even in terms of like maintaining friendships, once like we kind of all dispersed from undergrad to go to the States or even like internationally for further studies, I want to be known as someone who always puts 110%. This is something that my dad kind of instilled in me, like, at a young age training on court, but someone who always puts 110% in everything they pursue, so that, it's like they're giving it their best, if not more. And I think that's like a good mindset to have, and something that's good to be remembered.
Did your dad play sports out of curiosity?
He actually played chess, not very
Okay.
physical, but he's yeah, he played chess, and he actually trained some of the players who are like, famous now, when they were younger. So he's yeah, quite into it, and he'll be saying like E7 to whatever, and like he's very avid chess player.
There's a lot of very high level, I guess you're somewhat famous in the chess world, Tamil chess players, which is I found surprising.
Yeah, I think some of them from India. So yeah,
Yeah,
that's those are the ones that when they were like very young and just starting up. When my dad was in India, he used to train them.
interesting. Well, it's kind of a good segue into the last segment of the podcast. It's a speed round I like to call Creator Confessions. I'm going to say a bunch of statements, and you're going to tell me hopefully the first thing that pops to mind. Ready?
Yeah.
Favorite Tamil food?
Um, Mutton roll.
Good answer. If hypothetically there was a fire or something at your house or like wherever it was you're living, and you only had time to take two things with you, what would they be?
My phone, my laptop.
Something that scares you,
Spiders. Oh gosh.
insecurity that you have.
Um, hmm. Maybe I don't know, like physically, like how you look, like being an athlete and kind of transitioning to a normal person. So yeah, I would say like physical appearance in a way. Maybe it's
Favorite
more.
favorite TV show you're watching?
Um, Grey's Anatomy. I watched that on repeat. Guilty pleasure.
Since you're a traveler, a place you're itching to travel to.
Oh, Italy.
Great place. A fellow Tamil creator you want to give a shout out to?
Hmm. I mean, Scarborough has a lot of so the Love Scarborough campaign has a lot of Tamil people who are kind of stepping up and representing the Scarborough community. So I would say them.
Favorite childhood memory?
Honestly, I would say my mom cooks really good food. So probably just like, coming home from a rough tennis practice, and my mom's like mutton curry to come home to. So
Nothing beats Mama's mutton curry for sure. Something you like to do for fun outside of work.
tennis,
Favorite movie of all time. It could be Tamil, English, or both.
it's tough. Uh, I can't even think of one right now. I think I will go with Avatar, the first one though.
Hmm. It was pretty groundbreaking when it came out.
It came out. Yeah.
A decision you've been putting off for a while.
Hmm. Um, these are tough. The decision I've been putting off for a while.
This run is meant to be part therapeutic and part fun. So
No, it's really good. It definitely makes you think. Traveling more? No, like I don't even know if that answer counts.
we'll take it. A purchase you've made that you've splurged on recently in the last few years, but you have no regret about it.
Oh, I know this one. Okay, Breville Bambino coffee machine. Well, actually, that was something I was a decision I was putting off for a while, but I eventually splurged, and no regrets. Best coffee ever, like something I look forward to every morning. So
It sounds exotic. Is it like what's like
not
amazing about it?
sponsored. I'm not sponsored, but it's like really good shot. It's really good coffee.
Got it. Pet peeve of yours.
Hmm. Um, Saying words but no actions to follow.
If you knew that you were going to die tomorrow, a regret that you would have.
I'm not going to Italy yet.
A celebrity whose life you'd want to experience for one day, just
Oh,
one day.
Djokovic.
Um, a book you've read or a podcast you've listened to that's had an impact on you.
A book I've read, or actually, I don't know if this would count, but Adam Grant, he has like really inspirational quotes, and I think that that's something that I find helpful. Like, I don't know if it's like an actual podcast per se, but he does have some interesting content out there, so that's very inspiring and motivating.
A belief, behavior, or habit that's improved your life?
Waking up early in the morning.
And finally, a piece of advice that you want to give to your fellow aspiring Tamil creators out there.
I would say follow kind of your passion and follow your interest, and you don't have to kind of have all the answers in the early stages, but if you kind of keep following your passion and your interests, you will land to where you're happy.
Awesome. That's a great way to end off the podcast. Thank you for jumping on, Aarti, and sharing your story. For someone that's listening, like I said, um, this like a physician assistant, like career path and kind of just everything you've done in your life. For somebody listening that's inspiring for them and they want to reach out to you, what's the best way for them to connect with you?
Yeah, I share my journey on Instagram. So my handle is arthi.pa. And I actually started that 1 month before starting PA school. And I've been sharing my journey since. So feel free to reach out, check out my content on there just to see what my journey has been thus far.
Awesome. Well, thank you for sharing again. And for those of you guys listening, as always, appreciate it. And on to the next one.
Thanks, Sarah. Thanks for the opportunity.